Welcome back to a special edition of Flashpoint, focusing on mental health here in the Carolinas. An unfortunate reality of mental illness is that it can be deadly. In fact, suicide among the top 5 leading causes of death for folks between the ages of 10 and 65. Now, North Carolina state health officials are releasing a plan to lower those numbers. Joining us now, the program coordinator for North Carolina's suicide prevention program. It's Ann Geissinger. Ann, thanks for coming on. We appreciate it.
Thank you so much.
So the health department releasing this new sort of coordinated plan to help address mental health in the Carolinas. What do you think needs to happen to reduce the number of suicides that we're seeing?
That's a great question. In fact, this coordinated state action plan is directly addressing that. We are aiming to reduce injury and death by suicide. And in order to do that, you don't have just one way to do it. You have to have multiple ways to do it. So this plan provides a variety of strategies, both at the community level, at the policy level, to address suicide and to help prevent the injury and death that results from suicide.
Why are we, I know this is a complicated question that requires a complicated answer, but why are we seeing the numbers we're seeing right now?
This is an excellent question. I mean, suicide is one of the leading causes of death. Over the last 10 years, suicide deaths in North Carolina have risen by an alarming 26%. And perhaps even more concerning is the 48% rise among youth, ages 10 to 18. This is all happening in a world in which things are shifting rapidly. And of course, we've all been living in a pandemic. So multiple variables have contributed to the increase in suicide deaths over the last 10 years. The important point is that we are recognizing this trend and we are taking steps to counter it.
We talked about this coordinated plan. What all does it include? And why do we think this will help?
Great question. So this plan includes, how do I put it? It includes a variety of, I'm losing track of things. It includes a variety of steps from various divisions. So we have the Division of Public Health, reaching out to, for example, faith leaders and veterans that aren't in the VA system to work with them on suicide prevention. Meanwhile, we have the Division of Mental Health that has crisis intervention teams. So they have a very different approach, but incredibly important. And we have the VA that's working with their veterans directly. So we have all these different divisions and groups and partners that have different methods and different approaches that are all valid. But being able to coordinate those efforts is key in basically exponentially growing the effect that we can have in suicide prevention in North Carolina.
You talk about what the state can do and what governments can do. But what about us as everyday citizens? What can we do? How can we empower ourselves to go out there and help our neighbors and our friends and family members in need?
That's a great question. So there is a type of training called gatekeeper training. And gatekeeper training is teaching people to kind of put your radar up and identify when somebody is feeling a little out of kilter. And then how do you use your voice? What words do you use to approach that person and say, are you all right? Are you thinking of suicide? So empowering people to use those words to ask people how they're doing. That's what we as individuals can do. And we can also work with our schools, work with our faith communities, work with our businesses to elevate suicide prevention training. In many places, hospitals and many work sites, there's CPR. We know how to do CPR. If you see somebody's heart is struggling, you know how to do the compressions to help maintain them until they can get to help. That's what suicide prevention training is. It's not making you, the person that is the therapist or the counselor, but it's allowing you to identify somebody that is struggling and help get them to help. And I would like to also mention the 988, our crisis line, lifeline and crisis line, that you should promote it to friends and family, put it in your phone. So if you see somebody in crisis, you can simply ask, should we call them? Would you like to talk to somebody? These are things that we can do as individuals with family, friends, colleagues, people in our community to keep each other safe.
And for anybody out there struggling, I think it's important to say and important to arm them with the best information. What is the best way someone can get help right now?
I would say calling 988. And there are also resources online at the Division of Health and Human Services. Reaching out, there are people out there to help. There are people, programs, and training. But 988 is a great way to start.
Okay. Ann Geissinger with the North Carolina Suicide Prevention Program. And thanks for coming on and talking to us about a really important topic that we don't talk about enough.
Thank you so much for giving us the time and space to have this great conversation.
All right, Ann, thanks. More
Thank you.
Flashpoint after this.